Well, thank you so much for having me again. My name is Cheryl Schwartz, and I am the Senior Vice President for Takeda's U.S. Rare Disease Business and our Commercial Operations Group. And I'm also a member of Takeda's U.S. Executive Leadership Team. Um, this U.S. Rare Disease Business Unit that I speak of is comprised of a very large and diverse portfolio of about 15 different therapeutics that span a wide variety of rare disease areas, including hemophilia and rare bleeding disorders, lysosomal storage disorders, hereditary angioedema, and rare endocrine disorders, and our transplant business. So we have long been working with NORD on a variety of different initiatives, and we've also long been working on issues related to accelerating time to diagnosis and treatment for communities that are living with rare disease. So this initiative that we did with NORD is building off of a previous white paper that we did that looked at reducing time to diagnosis for people that are living with rare diseases, focused on policy initiatives. But as we were going through that initiative and that discussion, what we realized is that we needed to do a better job as a broader rare disease community on also focusing on how the diagnostic journey is complicated by health inequities that exist. So we know that being diagnosed with a rare disease is no small undertaking for any patient. That diagnostic process can take 6 to 9 years, and in some cases, it can take decades. But that is also compounded and complicated by health inequities. So whether that is things that are driven by systemic issues, things like structural bias, institutional racism, or broader issues surrounding social determinants of health, what we have found is that we as a joint community need to make sure that we're thinking through how do we really support all patients to ensure that they get the resources that they need to be able to get the diagnosis and the treatment for their rare disease. And that's really what precipitated this collaboration with NORD on this policy initiative as well. It's a very complicated undertaking. I think that there's a variety of different issues here in terms of diagnosis for rare disease. I mean, first and foremost is the horse's zebra analogy that we also often hear about, and that is that many treating physicians just don't have experience with rare diseases to recognize something when they see it. Many of these diagnoses can be very complicated and can require a great deal of exploration to understand, what is driving the symptoms that you're seeing in these patients. But that's further compounded by some very specific issues in terms of access to care. So some of the key issues that we focus in across all populations, but also focused on more equitable access for treatment, are areas like increasing equitable access to genomic screening. So we now have access to really great tools for full genome and exome sequencing, but not everyone has availability and access to those resources in the same way. We also, because so many of these patients are seen by a primary care physician or a pediatrician or a specialist that might not have expertise in rare disease, we need to make sure that we have greater support and access to both centralized and specialized rare disease centers of excellence, people that really have experience treating and identifying rare diseases. And how do we create more connectivity between the treating physician and those centers of excellence? Also, we really need to think about how we can break down some of the silos that exist with regard to the data landscape for rare disease populations, because these patients are so few and far between. We don't have the same access to data as we do in other more mainstream areas of health. So we really need to make sure that we are partnering across different constituents that work in the rare disease space to really improve the data landscape and make sure that we have access to this data to better inform treatment paradigms. And then we also really need to make sure that we have the appropriate and accessible, culturally relevant rare disease resources for patients as well. So I think, it's very easy to go onto your computer and sort of Google something about diabetes or heart disease. It's not so simple if you have a very, a very rare or ultra rare condition. And that's also compounded by if you have certain barriers to accessing information. So whether that is access to something as simple as, broadband access to be able to get, access to virtual information, all the way to translation. We've often heard that some patients that where English is not their first language have a really difficult time navigating the healthcare system as they navigate a diagnosis of a rare disease. So there's a lot of different factors that go into this and compound that diagnostic odyssey, and then that's further compounded by some of these access issues that relate to health equity as well. We at Takeda focus a lot on how we can help to support patient communities and treating communities in terms of accelerating time to diagnosis. And I think that there are things that can be done both at a macro policy kind of a perspective, all the way down to really practical types of actions as well. So, on the policy level, some of the things that we've talked about, for example, are access to genomic screening. We now have tools at our disposal that are relatively straightforward that can give us a ton of information on, many different types of genetically derived diseases. But we don't often have access to those types of screening tools in an equitable way. So one really practical element is, those people who have private insurance might have more readily have access to genomic screening, but those who have Medicaid access might have a much lower level. So I think from a policy level, we need to make sure that we're looking at this across all of our different communities to make sure that they have equitable access to that kind of care. Also, on a more practical level, the availability of data. How do we sort of democratize data and make it more available and accessible? So we've worked kind of across the aisle to really help think about how do we support that from a policy point of view, but also how do we help to support initiatives like the Rare Cap initiative that we've worked on with Children's National as an example, to create a repository of data and information around different approaches to treatment and centralizing data so that people can just get better access to information no matter where they are through centers of excellence. So there are some very big issues, and then we can go all the way to much more, smaller, more practical ways. For example, increasing the diversity of genetic counselors is a really practical way that we can make sure that we are communicating with different communities, really meeting them where they are, giving them the resources that they need to be able to navigate the healthcare system in a really meaningful way. So these are the types of things that we try to support and think about, whether that's on a larger policy kind of scale, all the way down to how do we support, more grassroots efforts with patient advocacy organizations or centers of excellence to make sure that we can provide those kinds of tools and educational materials that will help to support varying communities that are suffering from rare disease. Given that we work with so many different rare disease communities, the one thing that really holds true is that everyone wants to make sure that we can get to a diagnosis faster, because we can't do anything until we get to that diagnosis and we have the information that we need to get the appropriate treatment or support that those patients and their families need. So that is one thing that we all are incredibly aligned on across the board. So I don't think that there's one community that is that we don't focus on. I think the question is how do we sort of break down some of our biases to make sure that we're really thinking about how to best support all communities. So there is inherent bias, obviously, within the healthcare environment. I think anyone who's ever had any kind of healthcare treatment in the U.S. knows that it's difficult to navigate our healthcare system, right? So how do we help to make that navigation and that process easier? So I think that there's lots of different ways that we can do that. I think one really simple way recently, or I don't know if it's exactly simple, but it's something I think that's very productive, has been helping to support greater access to telemedicine. So for example, for people who live in rural areas or don't have the resources to travel to centers of excellence, we can now utilize telemedicine to be able to expand our reach and our educational support and even access to real experts in areas of rare disease that otherwise might not have been able to be accessed, as an example. I think also something that we focused on is investing in really accessible and culturally relevant resources that can support a variety of different communities. We do that using different types of digital materials that can be offered in different languages, and really emphasizing on sort of that diagnostic education, whether that's for a physician that might just never see this kind of a rare disease in their career. Maybe they learned about it at medical school and they need a refresher on some of these diseases that they haven't been exposed to in the past, or whether that's the patient or their family that needs more information on how to best support that journey for themselves. So I think that there's a lot of different ways that we can think about this. Yeah, I mean, a lot of these diseases are, genetic in origin, and many of them are progressive in nature as well. And so the sooner that we can get to a diagnosis, the sooner we can find the appropriate level of treatment and support for those patients and for their families. So, one is, I think, when you're going through that diagnostic experience, it can be incredibly stressful for a family that's already living with very complications of a rare disease and not knowing what's wrong with their child. But also, the sooner that we can get to treatment, the sooner hopefully that we can either stop progression of the disease or think about alleviating symptoms of the disease. So there's really, a bit of a clock that's ticking when you start to go through this process. And we think it's really important to make sure that we accelerate that process as much as possible, try to clear the road of barriers, whether those are systemic barriers or insurance barriers or information barriers, to make sure that patients can really get access to the information they need to best manage their own care. So that's the main reason. But ultimately, unfortunately, not all of these rare diseases will have treatments. So sometimes the diagnosis is about making sure that those patients also just get the information that they need to best support the symptoms, to help alleviate, suffering, or other types of interventions, whether that's, supportive care or other types of care for the family as well. So none of those things are accessible to us in our healthcare system until we have that diagnosis. So it's really kind of the trigger point for all of the subsequent support that's needed for these communities. Takeda has a variety of different areas that we work in, from very large-scale policy initiatives where we partner with others that have a vested interest in this space, like NORD, like other rare disease centers of excellence, or other patient advocacy groups, to really try to move the needle on large-scale policy initiatives that could help to improve this diagnostic odyssey. So one area, for example, that we've worked in is on newborn screening, to really help to accelerate and make sure that we're supporting patient advocacy groups that are trying to get their genetic disorder onto the newborn screening lists that happen both at the national and at the state level. So that's something very practical that we work on, and we've worked on that, for example, with the MPS II community most recently. We also, like I said earlier, work on very grassroots efforts at the educational level to make sure that we're thinking through carefully how do we support that education both for healthcare providers and for patients. So we do a variety of different types of initiatives, working again very closely with patient advocacy organizations to make sure that we really understand what the needs are of that unique community and how we can help to support them through education and other resources. So there's a variety of different things that we do in this space, from very large scale policy all the way to kind of, individualized support of patients and communities. And I think that that's really our focus, is making sure that we are looking really under every stone, leaving no stone unturned, to make sure that we're thinking through all of the ways to support rare disease communities.